Hello, everyone. Good morning. Rob Bonta, California Attorney General. Thank you for joining us today. Today, I am co-leading a coalition of 23 states in filing a lawsuit against the U.S. Department of Health and Human Services, led by Secretary Robert F. Kennedy Jr., for attempting to unlawfully terminate $11 billion in critical public health funding. More than $972 million due to California alone that our state and local health agencies rely on to serve millions of children, seniors, and rural communities. If allowed to take effect, this termination would sabotage California's ability to protect and guard the health of millions across the state and put thousands of workers across the nation at risk of losing their jobs. We're talking about a massive cut that came with no advance notice or warning. A dangerous, arbitrary, capricious, and unlawful cut that has already caused widespread chaos and confusion. Today, our coalition has asked the court to immediately block the termination and allow states to retain access to these essential public health funds while our case proceeds. I'm grateful for the partnership and commitment of this coalition of attorneys general and two governors who are willing to take a swift stand against the Trump administration's latest attempt to steamroll over the health and well-being of the American people. I'm also grateful for the dedication and tireless efforts of the public servants in California DOJ's Healthcare Rights and Access Section and across the department who worked through the weekend to make this lawsuit possible. Incredible attorneys and legal professionals who are on the front lines of the Trump administration's relentless attacks on our democracy, our justice system, and our people. While most Americans may never know their names, they're the ones fighting for your rights, your freedoms, your safety. Thank you to all of them. I can't understate the gravity of the Trump administration's latest attempt to gut critical funding intended for a wide range of essential public health needs that haven't gone away just because we're no longer dealing with the worst of the pandemic. Funds that are being used to identify and track and address infectious diseases like measles, bird flu, Zika, and Ebola, that are being used to ensure access to vaccines, fortify our ability to respond to emergencies, provide mental health and substance abuse services, and modernize critical public health infrastructure that benefits all of us. HHS may claim that these funds are no longer needed because they were meant to respond to COVID, but that's just plain false. A baseless political soundbite. Let's talk about what these funds actually do. California's Department of Public Health would lose $800 million intended to vaccinate 4.5 million California children against preventable illnesses and help hospitals care for injured and ill patients during all types of emergencies. California's Department of Healthcare Services would lose over $119 million that was meant to support substance use disorder prevention and early intervention services for youth in at least 18 counties, among other key initiatives. Los Angeles County would lose more than $45 million that it relies on in part to respond to over 50 current infectious disease outbreaks, including measles, seasonal flu, and bird flu. As a result, the county public health department will have to let go of most of its outbreak team, which means it won't be able to adequately respond to infectious disease outbreaks at schools, on work sites, in assisted living facilities, shelters, or jails. That poses a serious health and safety risk to all who live in, work in, or visit LA County, the most populous county in the country and a major hub of international travel. Another example is Sacramento County, which will lose $26.5 million that it needs to investigate outbreaks of foodborne diseases and other yet-to-be-identified communicable diseases and provide other vital services. Riverside County would lose over $144 million that was intended in part to implement and conduct wastewater surveillance to detect the early presence of communicable diseases. The city and county of San Francisco would lose over $6 million meant to educate residents about infectious disease prevention and the opioid epidemic and provide other preventative supports. Santa Clara County would lose over $11 million, which the county needs to purchase essential supplies, provide emergency preparedness trainings, and help underserved communities access health screenings and care, and provide other preventative supports. The substance abuse and mental health services grants that have been awarded to multiple recipients, including California, support programs that are necessary far beyond the end of the pandemic, expanding access to behavioral health services in rural areas, supporting substance abuse prevention and early intervention services programs for youth, implementing mobile crisis care services to prevent unnecessary emergency department visits, supporting programs that serve youth in the foster care system, and providing behavioral health crisis intervention training for law enforcement and first responders. Those are the types of essential public health programs and initiatives that serve us all, that HHS wants to slash. Programs that make our communities safer today and for years to come, make our communities healthier. Now let's talk about how RFK Jr. and the Trump administration are breaking the law. This attempt to terminate already appropriated federal grants is arbitrary, and it's capricious and a clear violation of the Administrative Procedure Act. It far exceeds any statutory or regulatory authority given to HHS and undermines Congress's constitutionally delegated power of the purse. In short, Trump and RFK Jr. are completely out of bounds. Congress already legally appropriated the grants, as is its job, and the funds were already legally awarded to states and local public health systems. With these cuts, the administration is trying to cut Congress out of the picture. If I were Senate Majority Leader Thune, House Speaker Johnson, or any GOP congressional member, I don't think I'd take too kindly to a president who purports to be a partner, usurping my responsibility and effectively deeming me useless as a member of a co-equal branch of government. The boilerplate statement that HHS put out to announce the devastating termination had no real clarity, facts, or details, and claimed to terminate the grants because the pandemic is over. The nothing burger of a statement gave no rational basis and assumed, with no facts, that the appropriations were only intended for use during the pandemic, which is untrue. It failed to analyze the benefits of the individual grants, consider states' substantial reliance on the grants, or take into account the harmful impact of terminating them immediately. It gave no explanation about how HHS came to this decision or the sudden change in HHS's position. And it arbitrarily claimed that the termination was, quote, unquote, for cause, in a way that is entirely inconsistent with actual legal standards. On top of that, the Trump administration hasn't shown or even claimed that any of the grantees failed to comply with the terms or conditions of the grants. The reality is the end of the pandemic isn't a just cause to terminate these grants, in large part because none of the appropriated funds were constrained to the pandemic. The grants expressly authorize investments in public health systems and infrastructure to prepare us for other public health concerns and future pandemics, the need of which was made clear when the HHS granted numerous extensions to the grants, some scheduled to go as far out as June 2027. Last but not least, the unlawful termination was delivered with no notice and no warning, throwing state health agencies into chaos and into confusion, limiting their ability to plan for a possible change, wasting resources as health departments scramble for next steps, and pulling the emergency brake on very necessary work. President Trump and Secretary Kennedy would have you believe these funds are no longer needed because the pandemic is over. But nothing could be further from the truth. In 2020, we saw firsthand what can happen if our public health systems aren't prepared or equipped to jump into immediate action in the face of an outbreak. We saw the devastating gaps in our healthcare system that left marginalized communities without access to adequate, appropriate, or affordable healthcare. Hard-learned lessons that we can't afford to forget. hard lessons only a fool would ignore. Our states are counting on this funding to prevent the collapse of our health systems in the event of emerging threats like a potential outbreak of measles or the bird flu, not hypothetical, not imagined, which we're right now seeing pop up in alarming numbers. We count on this funding to provide cost-effective preventative health care like vaccines that prevent the spread of illness and alleviate burdens on our emergency rooms. We count on it to keep our kids, our seniors, and our communities healthy, to save lives. Lives. That's what's at risk here. This marks the 9th lawsuit I've had to file against the Trump administration. While it's no longer surprising when the administration willfully violates the law and puts the public in harm's way, it is still shocking. It's shocking that the President of the United States has seemingly zero regard for the law and the Constitution that he swore an oath to uphold. It's shocking and disturbing that the president has no concern for the health and well-being of the people he serves, and in fact, seems to be trying to cause harm. It's shocking that a president who said he'd create more jobs and make life more affordable is willing to fire swaths of workers, leaving their families high and dry. While the president's reckless abandon and proclivity to break the law is becoming more and more commonplace, we cannot allow ourselves to become desensitized to the reality we're in. We can't put our heads in the sand and hold our breath for the next 4 years. We have to pay attention. We have to demand better. We have to hold him accountable. As Attorney General, I always will. No matter how much the president throws at us, no matter how hard he tries to distract and divide us through hateful and inflammatory rhetoric, no matter how many chaotic, nonsensical, and unlawful executive orders, actions, or memos he issues, we'll be here, monitoring every step he takes. You've got my word. When the president breaks the law, violates the Constitution, or puts our people in harm's way, I'll be here to take him to court. Before I open it up to questions, I want to again thank my incredible team at DOJ for this work on this lawsuit. They don't do it for the limelight, but I'm going to shine it on them anyway. Jamara Thorburn, Crystal Adams, Anna Rich, Heidi Lehrman, and Nellie Palma. Thank you. It's an honor to serve alongside each and every one of them. With that, I'd be happy to answer your questions.
If you would like to ask a question, you may do so by clicking on the raise hand icon at the bottom of your screen. You will then be moved into the queue. Please wait until I call on you to ask your question, and please state your publication. You may also use the Q&A feature at the bottom of your screen to ask a question. Again, if you'd like to ask a question, please do so by clicking on the raised hand icon at the bottom of your screen. The first question comes from Nicole. Nicole, you are now unmuted.
Hi, can you hear me? Sorry.
I can hear you perfectly. Thank you.
Yes, this is Nicole Norman from Politico, and I'm just wondering if you have any idea on how quickly the funds can be returned.
I do. Like in some of our other cases that we filed among the 8 prior to this one, we are moving for a restraining order, an injunction, an order from a court to stop the unlawful withholding of the billions in dollars of federal funding here, 11 billion specifically in public health funding. So sometimes we get a order within hours, sometimes it's within days. Obviously, there's a possibility that a court may not issue an order in our favor, but we're confident here, as we have been in the past. We believe the facts and the law are on our side, and we've moved for immediate relief because the harm that we are at risk of suffering here because of this unlawful action is irreparable, irreversible, and it would be appropriate in our view for a restraining order to be issued. We also believe we're likely to succeed on the merits, which is the standard, along with the likelihood of suffering irreparable harm for a temporary restraining order. So we could see a decision within hours. We filed today in the District of Rhode Island. There could be a decision later today. That will be quick, but it has happened in the past. More likely, it will be in a matter of days, but we are hoping for a court order to immediately halt the unlawful termination of the $11 billion in public health funding.
Gabriel from the San Francisco Standard asks, you mentioned 6 million in San Francisco related opioid funding. Are there other San Francisco related health programs at risk besides this one?
The 6 million meant to educate residents about infectious disease prevention and the opioid epidemic is the highlight that we are putting forward with respect to the city and county of San Francisco. We can do a little deeper dive since, of course, you have an appropriate interest in the city and county and identify what might be additional, and we can follow up with you separately.
Next question comes from Nicole. Nicole, you're unmuted.
Hi, sorry, I have one more question from my colleague Rachel Bluth at Politico, and she is wondering, because the National Women's Law Center just filed a complaint on behalf of Anna Nusslock against the Providence St. Joseph, the same case that you're also pursuing after the hospital denied Nusslock's emergency abortion. And we're just wondering if you have any comments on the new suit and how this will interact against the hospital. A bit unrelated, but just wanted to ask.
I haven't seen their complaint or the details of their lawsuit, so can't comment further than that. Obviously, the story of Anna Nusslock is very powerful and moving, and her unlawful treatment completely inappropriate. And we have laws in California, including rights to emergency care. We believe that that right was violated, and that Ms. Nusslock's rights must be vindicated. So any efforts in that direction, I support in terms of any attempts to make sure that violations of the law against Anna Nusslock are remedied.
And I think that's it.
Super. Thank you, everyone. Thank you for joining us. I am sure we will be talking to you again soon. Thank you.